First speaker will be Dr. Santhan Gopal. He doesn't need any introduction. He is a past president of All India AIOS, and he is a very good. He is an authority on amblyopia as well as trabeculopathology and pediatric ophthalmology. Dr. Santhan Gopal is going to start his first lecture on Orthoptec.
Good afternoon. My first talk is on Orthoptec. After that, I have to take leave with the permission of the chair, since I have a talk somewhere else. Now, the machine Orthoptec is used for treatment of a number of conditions like amblyopia and related conditions, fourth nerve palsy, sixth nerve palsy, and in treatment of nystagmus, and improving in hand-eye coordination, also improvement in stereopsis, particularly in for reasons we do not know why the stereopsis is reduced. You can use this, and it's used in treatment of problems, ocular problems in cerebral palsy, and also to an extent in optic nerve problems. Now, how do I know that it's all used in these? More than 85 people all over India are using this with perfectly happy results, including the current president, Center for Sight, and Arvind Eye Hospital, and a few other important places. All over India, from north to south, they are quite happy using that. These are the references given by them. Now, if you understand this, you understand Orthoptec, why it works. Basically, it depends on the principle that there are impulses within the brain which come from centers like frontal eye field area and parietal area back to the occipital cortex, and when they come back to the occipital cortex, they fast forward the impulses coming from the retina to the occipital cortex. This is where the crux of the problem is in amblyopia, that there is a blockage at the level of level 4C beta in occipital cortex, and therefore there is no further transmission of impulse from occipital cortex to the temporal cortex, which is exactly the place where the vision is analyzed. The occipital cortex works only as an image transmission center. It does not have its own brain to understand the quality of these images. It passes it on to the temporal cortex, which analyzes and sends it back to the occipital cortex via the cognition center. See, it's a very complicated process, the whole vision. What you see, the brain has already knows. If the brain knows what you see much faster. If the brain doesn't know what you are seeing, it takes longer time. And if the brain never knew what you are seeing, you will never see. So it's actually you see with the brain, not with the eyes, but you see with the brain with the help of the eyes. That's the one you need to understand. Now, many people, this, as I told you, this is the place where in occipital cortex the problem is due to glutamate release, vision happens at level 4C beta. This glutamate goes to the postsynaptic membrane where it releases nitric oxide. The nitric oxide travels back and further transmits the impulses forwards. In amblyopia, there could be any number of reasons why there is a problem. There could be reduced glutamate reduction, there could be absent glutamate reduction, or there could be absent nitric oxide production. All these things lead to, we don't know, because at the micro level, we do not know exactly, but all we know is the problem is at the level 4C beta level in the occipital cortex. That's why there is visual problem in amblyopia. So the Orthoptec tries to utilize the impulses present within the brain. They are already existing. We are not creating any new connections. They are already existing. So when peripheral retinal, I'll show you that in a few seconds. If you understand, this is the most complex picture you need to understand. Whenever you stimulate the peripheral retinal cells, M cells, otherwise called as magnocellular cells, the magnocellular cell stimulus, when it is stimulated, the impulses reach the parietal lobe much before. the occipital cortex is stimulated by the P cells. The P cells are in the center, whereas M cells are in the periphery. The rate of transmission of impulses along the M cells is much faster than it is with the P cells. And secondly, the attention center is within the parietal area, and therefore the parietal area has an access to the M cells much faster than the P cells. So the brain already knows what it is seeing because of the faster transmission along the P cells. Now all these things may sound Greek and Latin, but the Orthoptec works because of this small principle that the M cell stimulation leads to repeated P cell stimulation, which is the central area which has problem in amblyopia. That is why our ancestors said Sarvendriyanam Nayanam Prathanam, because this is the connection, how the eye is connected to with the brain and how the vision is processed in the brain, the most complex. Now, although the instrument is instrument looks like this, instrument is very simple to use. Even children can set it up, it is even easier. You can see here how it is set up. It is set up like a TV, not very difficult, but at a particular height and a distance from the this thing. I can see the children as young as 3 years and 5 years and adults using this instrument. Can reduce the volume on that. This is a 5-year-old child doing that and pointing out the light with the laser pointer, and this is a 3-year the second one. Start this child. Okay, this is a second year. Reduce the volume of the video, and you can see this 3-year-old child with intermittent avison squint pointing out the light with the fingers. And what is the connection between the fingers and the eye? The simple connection is in the frontal eye cortex. In the frontal eye field area in the cortex is closely connected to the hand area in the cortex. Whenever the hand moves in the direction in which the eye moves, the two are stimulated simultaneously. The stimulation of frontal eye field area in turn stimulates the occipital cortex, and stimulation of the occipital cortex obviously
The hand-eye
program
coordination
one
and
where
also the
she is pointing out
binocularity of the child.
the lights
You can
which
see that
come
she is
on
pointing out
with
all the
the
lights which
laser
come on.
So this is the simple principle on which the Orthoptec works. Not simple but complicated principle, but simple to set up, and even you can see how she is pointing out the lights which come on. Whenever the hand moves and the eye moves in that direction, the frontal eye field area is stimulated. The hand movement and the frontal eye field area stimulation are closely interlinked, and therefore every time the hand moves, the frontal eye field area is stimulated. Stimulation of the frontal eye field area in turn stimulates the occipital cortex, and stimulation of the occipital cortex in turn leads to excessive glutamate release, which stimulates the vision. This is the principle on which Orthoptec works. If you have any doubts or questions, you can just copy this, take a photograph of this QR code. All the details are given in that. You can read through that. There is a DSTC course now which I have to go. If anyone is interested, you can come and take a picture and discuss it with me, any amount you want. Because 6 minutes is not enough to tell you about my 2 years of experience with this equipment. Dr. Shreya is another person who is using it. She will tell you more. Thank you very much.
I have used and I have seen the results, wonderful results, especially for amblyopia, stereopsis and contrast sensitivity. Still we are studying for strabismus, so I will guide because we have not